Can you tell us why stakeholder engagement is important to your organization?
Thank you very much. It's a real pleasure to be here today with all of you. So in Nova Scotia, we are a small province with lots of big problems. And those problems relate to the health of our people. We spend 41% of our resources, government resources, on health care. And we haven't changed the bar at all in the past decade in terms of overall health status. So in 2015, the government of the day made a decision that we would have one health authority, Nova Scotia Health Authority. And so we are charged to provide all health services in the province of Nova Scotia, except for those that are offered by the IWK Health Centre. So we needed real change. We needed real different outcomes for the population. And so we, in our initial beginning, said that our significant difference would be how we engage the people of the province in deciding together what we wanted for health of our population and how we were going to use our resources of the health system. And so in our organization, our first strategic plan, one of the pillars, the three pillars, was engaging Nova Scotians in creating a healthier tomorrow. And we've called our strategic plan Healthier Together. So we see public and stakeholder engagement as a key innovation in how we do our work. And we believe it can be the catalyst that creates the imperative for change in our organization, because together we need to have all Nova Scotians saying that our vision for healthy people, healthy communities is really our collective vision. Meaningful engagement, and I applaud what my colleagues have said here, and real conversations are essential to change. And we believe as an organization that when people are engaged in the why, the what, the how, the maybes of decisions, that they can become part of them. They can help own them, and they can help champion our common path forward. We understand that we need to build coalitions. We have to create opportunities for the people to be champions for change, because all of us know, I've been in the health system for my whole career, and change is really hard in the health system. And particularly if you change how services are provided or where they're provided. And so we really need to work together with people, so it's our change, it's our plan together. And I agree with my colleagues here who have said that individuals who are affected by a decision have a right to be involved in that decision. And health is a concern for all Canadians. And we are working hard in our organization to build a culture where engagement is embedded in our everyday work. It's how we are, it's how we understand our work, and it's how we set our priorities in all levels of our organization. And our goal then is to create a shared accountability for health. So for us, this means engaging the people we serve across our province, and in our case in the Maritimes for many of our services. And it means engaging the 40,000 people who come to work, learn, or volunteer in our organization so that they can develop skills to engage with the people we serve. And I was listening to my colleagues here. We should not assume that we know how to do that. We should not assume that we know how to truly be authentic and to really be in a situation where we are engaging to listen and to understand, and to really take the feedback and then to demonstrate how we have used that. And so we have put some effort into that. And it means engaging others who have, I said we're pursuing a different health outcome for our population in the long term. So a health organization is only one part of that solution. So we have to, I call it, get over ourselves and understand that we have to work with others in a way that we collectively can create a different environment and a different culture in our communities. And so that's engaging citizens, the communities themselves, community leaders, government, business, education, social services, chambers of commerce. And so it's all really about creating that, I call it a rolling, engaging conversation in our province about what do we want our environment to be What is it like to live and grow a family there? Can we support health for all? So we're doing some of a variety of things. In our first year, we identified that engagement with Nova Scotians would be our strategic priority. We defined our philosophy, and as Marcy is saying, you have to be really clear about that and really understand what we mean, and it's not one-sided. And develop the framework for engagement so that when we go into a room with people, we can say, this is why we're here, and not have people thinking they're here for one reason and not for another. Be very transparent and upfront. And so we have a grid in terms of our engagement strategies, what we're trying to achieve, and we need to be upfront about that and explain it to people. So we launched a public engagement strategy called Talk About Health, and 10,000 people added their conversation to our work. It was absolutely mind-changing and very helpful to us. And we could talk more about that if you wanted. We also created a patient, family, and community advisory committee to provide advice on our policies, on our program planning, and our delivery of services. And we've expanded the role of the patient advisory groups in our quality teams. We focus, as I said, on building internal knowledge and capacity among our teams to enable them to meet this mandate and commitment for engagement. So that meant we had to do a lot of effort in terms of training and developing modules that are ongoing and available to people, and tools and resources to support the work. We're building engagement into our development of infrastructure. So some of you would have heard probably that our QE2 Health Sciences Center academic Health Sciences Center needs to be redeveloped. And so we've developed an engagement process to help to be informed by the people who are served there in what we need to do. And I'll give you an example of using this engagement process. In one of our rural communities, when we became Nova Scotia Health Authority, they had already a plan for a replacement of a hospital. When we looked at the replacement of the hospital, it was replacing the 1967 hospital. Wooden structure, all those, it needed to be replaced, but it was replacing it with exactly the same thing. And so we went in and said to them, let's talk about the population who is here, how it is changing, how it's changed over 10 years, how it might change in the next 10 to 20. And as Marcy said, we brought in the hard, cold data in terms of what we knew, and then we talked to them about the lived experience of that community. What's it like to be here? What are your hopes and dreams for that community? And over a period of 6 months, we have submitted to the government, and it's funded, a new plan for the facility that will be flexible and carry us into the future. It's not what the original plan was, and everybody is in agreement. The first time I went into that community, I met 219 people who wanted to stand up and tell me that you're just here to close our hospital and all the things that they think CEOs do. So I offer you that example to say you cannot be afraid to engage people. There is real information from the people we serve that will inform good decisions. So we see public engagement as a long-term improvement of our province's health status. We see it as a tool, an instrument to shape every aspect of our work. And we believe that by listening and learning together, we are creating a dynamic environment that will help us all prepare and create the future that's required so that in our province we have healthy people and healthy communities for generations. Thank you.